Question number 21. Root level of knee jerk is option A S1, S2, S3. Option B is L3, 4. Option C is S1, S2. Option D is L2, 5. Option E is L1 and L2. The correct answer in this scenario is option B, that is L3 and 4. Rest of the options are false because ankle jerk is with S1. Knee jerk is the only reflex which is with the femoral nerve, and that is supplied by L3 and L4. Question number 22. The hip joint is directly related to option A, anteriorly to the sciatic nerve. Option B, inferiorly to the gluteus medius. Option C, inferiorly to the obturator externus muscle. Option D, posteriorly to the psoas bursa. Option E, posteriorly to the femoral nerve. The correct answer in this scenario is option C. Inferiorly, it is directly related to the obturator externus muscle. Rest of the relations you can see in the slides shown. Question number 23. An old man trying to cross the road stumbled and fell and was hit by a passing car. He was transferred to a hospital where X-ray showed fracture of the neck of left fibula. On examination, the patient's lower limb, he was unable to perform dorsiflexion and eversion of the left foot. The most probable diagnosis could be injury of the left. Option A, common peroneal nerve. Option B, G peroneal nerve. Option C, peroneus longus. Option D, superficial peroneal nerve. Option E, tibialis anterior. So the correct answer in this scenario is option A, common peroneal nerve, because it is most common nerve injured when there is a fracture of head of fibula, causing inability to dorsiflect the foot. Question number 24. Most likely paralyzed muscle taking origin from femur which causes instability of knee joint is option A, rectus femoris. Option B, sartorius. Option C, vastus lateralis. Option D, semimembranous. Option E, semitendinous. So the correct answer in this scenario is option A, vastus lateralis. Its origin is from the intertrochanteric line plus linea aspera of femur, and its insertion is tibial tuberosity, and its function is to extend the tibia. Question number 25. Loss of eversion of foot occurs due to damage to which of the following muscle? Option A, tibialis anterior. Option B, tibialis posterior. Option C, soleus. Option D, peroneus longus. Option E, gastrocnemius. So the correct answer in this scenario is option D, that is peroneus longus, because it is extensor of the foot. Option A and B are the inverters, and option C is plantar flexor of the foot. Question number 26. A 19-year-old man sustained a penetrating injury on the back of knee. Clinical examination reveals the lesion of lateral popliteal nerve due to the following findings. Option A, foot drop. Option B, spared the extensor of big toe. Option C, causes paralysis of the inverters of foot. Option D, causes sensory loss of medial surface of leg. Option E, undisplaced fracture of lateral condyle of tibia. So basically this question is about the common peroneal nerve. In this scenario, they are playing with a trick like using the word lateral popliteal nerve, which is also known as common peroneal nerve. So the correct answer in this scenario is option A, foot drop, because injury to common peroneal nerve or lateral popliteal nerve causes foot drop. Question number 27. An 18-year-old girl is having a progressive painless swelling at the knee joint. On examination, it is found to be present at the upper end of tibia. Biopsy shows the presence of spindle-shaped cells with many multinuclear giant cells and areas of hemorrhage and few mitosis. This picture is suggestive of option A, tuberculosis, option B, giant cell tumor, option C, osteosarcoma, option D, chondrosarcoma, option E is chronic non-specific osteomyelitis. So the correct answer in this scenario is option B, that is giant cell tumor of the osteoclastoma. Spindle-shaped cells are usually found in the giant cell tumors of the tibia. Question number 28. A 20-year-old well-built athletic male has come to the emergency with fracture of femur. The following will be true regarding it. Option A, unites within 2 weeks. Option B, heals by membranic ossification. Option C, can cause pulmonary embolism. Option D, causes hypercalcemia. Option E, can occur with a minor injury. So the correct answer in this scenario is can cause pulmonary embolism. Rest of the options are false because bone usually heals in 8 to 12 weeks and they cause hypocalcemia, and femur fracture is not usually with the minor injury. Number 29. Big toe infection is carried to the following lymph node. Option A, vertical group of superficial inguinal lymph nodes. Option B, medial group of superficial inguinal lymph nodes. Option C, lateral group of superficial inguinal lymph nodes. Option D, deep inguinal lymph nodes. Option E, external iliac lymph nodes. So the correct answer in this scenario is option A, that from the toe, the lymph node supply, lymph nodes drainage is to the vertical group of superficial inguinal lymph node as shown in the picture. Question number 30. A 60-year-old man with a thrombus of femoral artery requires the placement of a stent. During the operation, the likely finding regarding femoral artery is option A, a continuation of common iliac artery. Option B, lies outside the femoral sheath. Option C, has femoral nerve lying lateral to it. Option D, passes at midpoint on an inguinal ligament. Option E, pierces the adductor longus. So basically this question is about the relationship of the femoral artery. The correct answer in this scenario is option C, that femoral nerve lies lateral to it. The rest of the options are false because it is continuation of external iliac artery and it lies inside the femoral sheath and it passes at midpoint between anterior superior spine and the symphysis pubis, not on the inguinal ligament, and it doesn't pierces the adductor longus, rather it pierces the adductor magnus, known as adductor hiatus. Question number 31. A 28-year-old adult has a boil on his scrotum. Which group of lymph nodes should his doctor expect to be enlarged? Option A, medial group of superficial inguinal lymph nodes. Option B, lateral group of superficial inguinal lymph nodes. Option C, vertical group of superficial inguinal lymph nodes. Option D, deep inguinal lymph nodes. Option E, external iliac lymph nodes. So the correct answer in this scenario is medial group of superficial inguinal lymph node because it receives the lymph drainage of medial side of the leg and also the scrotum. Rest of the questions are false. Question number 32. To lift the left foot off the ground while walking, the muscle playing an important role is option A, quadriceps. Option B, the left gluteus maximus muscle. Option C, the left gluteus medius muscle. Option D, the right adductor longus muscle. Option E, the right gluteus medius muscle. The correct answer in this scenario is option E, that is right gluteus medius muscle. Helps in the lifting the left foot off the ground because it causes stability of the pelvis. So the trick in this question is that it is asking for the left foot and asking the function of the right side gluteus medius. So you have to be careful while answering these types of questions, that you have to remember the function of the gluteus medius muscle, and you should not be confused when they are playing with the options like putting the left and right gluteus medius muscle. Every time you have to remember that gluteus medius muscle is helping the opposite side of the pelvis.